Indeed, Trent RN at UnityPoint Health Lutheran Hospital, as we're talking about a very serious subject, but it's serious, but it's good to know that some people right here in Des Moines can treat you in case something like this happens. We're talking about heart failure.
Exactly.
Good morning.
Good morning. Thanks for having me. February is Heart Month, so I'm excited to be here to get some of the community awareness out about heart failure. Risk factors, things to look for, how we diagnose and treat it, and then some very exciting things that are coming up for folks.
As you say, when you consider heart failure, it's not like, ooh, yay, exciting, but there is some great news we're talking about today.
Great news.
Okay, we'll finish off with the awesome news that just happened last week at Lutheran, but let's start with risk factors.
Okay.
What are some of the risk factors?
So folks, well, the reason heart failure is becoming more and more important, to give a little intro, is there's about 5 million people in the United States now that are living with heart failure. Another 400,000 in the next year we expect to be diagnosed. And the symptoms are insidious and not easily recognized up front. And younger people are being diagnosed. And so we're wanting to get the word out for what to watch for. Risk factors first would be anybody that's had a heart attack. So that seems to make sense to people. There's been injury to the muscle, so you would expect some degree of muscle weakness from that. But the things that get missed, or anybody diagnosed as a kid with a heart murmur, should be evaluated as time goes on, because valvular disease is a common cause of heart murmur and can lead to heart failure later in life. Right. Anybody that's diabetic, the vascular system in general suffers from diabetes, and so that's a risk factor. Anybody with sleep apnea. That's another one we're finding tons of information about, the correlation between sleep apnea and heart failure. So things not to ignore when you're younger. And the big one that people don't equate and probably affects the most people is long-standing hypertension or high blood pressure. So that Know Your Numbers campaign is critically important when people are younger, 30s, 40s, 50s, because once the damage is done from high blood pressure, now we're behind the 8 ball. And the treatment is hopeful, but you don't ever cure heart failure. You diagnose it, you treat it, and you manage it. So high blood pressure, what it does to the heart as a muscle is, you know, the blood pressure is high in the vascular system distal to the heart, so the heart muscle has to pump harder all the time against that pressure.
Force it through.
They call it the silent killer because for 2 or maybe 2 decades, you have high blood pressure, you don't have any symptoms from that. By the time the heart muscle is so weak, working against that pressure all those years, now you've got symptoms and now the damage is done.
So you're overworking the motor.
Yes, it's a muscle like any other muscle.
Now those statistics that you gave us right off the top, are those people that have already been diagnosed we have here in our country, or are those people that are out there that don't even realize they have a heart issue?
Those are diagnosed. Wow. So many more that probably are suffering with heart failure and don't recognize it.
Don't even realize it.
Okay, so those are what we have to, now what do we have to keep an eye out for?
Okay, so symptoms of heart failure at the beginning are pretty insidious, and the main one, people when they look back on the course of their illness will say, I just was so tired all the time. And they equate it to, I'm getting older, and so
you're busy,
I'm not as physically fit as I used to be in my 30s and 40s.
So just general tiredness and fatigue.
Tiredness, and then the big one is when it gets to the breathing, nobody can ignore it. So shortness of breath. Usually starts with a flight of stairs didn't used to bother you, now it does, so you take the elevator. People make lifestyle modifications without recognizing symptoms that are leading to that. When you can't lay down and breathe, that's a classic one.
People can't
lay down and breathe.
Like to me, that would be a huge, like, ding, ding,
and people ignore it. They'll sleep on 2 pillows, or they'll go to 3 pillows, or they'll go to the recliner.
Really?
And they ignore it, and that is classic. And then the swelling, edema, we call it. So when the heart isn't pumping as well as it should to feed the rest of the body, which is all heart failure means, the muscle is weak for whatever reason, fluid will congest downstream, usually in the feet and the ankles, legs. Some people will carry it through their abdomen. They'll say, just my pants are tight. Everything else seems to be fine. And so it's where the fluid is congesting. If you remember, if you have grandparents or aunts and uncles that said they had congestive heart failure, it used to be called congestive heart failure. American Heart has since dropped the congestive part of that term and just refer to the condition as heart failure. So the congestion refers to where that fluid is congesting in the body because the heart isn't moving it around well enough for the kidneys to pull off the extra and it sits somewhere. So people, when we see them hospitalized, typically it's the breathing, because they can't ignore that. It's the fluid gain in the legs and feet and hands, and sometimes they'll get really wheezy, sometimes have a productive cough, but all of those things are late signs.
Now, if someone's at home being like, you know what, she's speaking to me or she's speaking to someone I know that might be having these issues, what should they be doing right now?
Okay, there's very simple tests to diagnose heart failure. Most of them are painless, and your family doctor can do a lot of them. It'll show up on a chest x-ray if there's fluid in the lungs. The diagnostic test for heart failure is the echocardiogram, which is a simple ultrasound of your heart. And it looks at how the wall motion in all the chambers of the heart is moving to pump the blood. And it gives us a number called the ejection fraction, or EF. And that gives an idea of how well the heart is pumping in general. So normal folks with a normal healthy heart would have an ejection fraction of 50 to 60, upper 60s. Somebody with heart failure with the heart muscle weakened enough to have symptoms would have that number around 40 or below.
Now, how do they get that reading? Is it taking a picture like an X-ray?
Taking an ultrasound. So just like you ultrasound the belly, you ultrasound the heart.
Okay.
Yep. And the cardiologist will read it. And it's kind of a measurement of how much blood is pumped out of that left ventricle to feed the whole rest of the body based on how much is left in there. And that tells them how well the heart is working as a pump.
Now, does heart failure affect men and women equally, or is it?
It does. And we're seeing younger and younger people with it.
Why is that?
Some of the things that get missed are there is a viral cardiomyopathy, or some viruses will attack the heart. The other thing that people don't equate with heart failure is alcoholism. Alcohol is toxic to the heart over time. And so sometimes we'll see folks that have maybe recovered even from alcoholism, then we'll see them in their late 40s and early 50s, and they've got a very weak heart muscle.
Because of that?
Because of that.
That's very interesting. Now, is there anything you can do to try to avoid having any of these things happen? Anything
Yes, lifestyle modifications in general for all of us, and certainly these apply to people that have been diagnosed, are the same things that help with high blood pressure. Watch the sodium in your diet.
Still watch the sodium.
Still,
Okay.
2,000 milligrams or less a day is what we'd want every heart failure patient on. Works the same way it does for high blood pressure. Sodium chemically holds water. Supermodels know that.
Okay.
Their eyes get puffy if they eat salt before a shoot, so they don't do it.
They don't do
Take the
it.
pie or
There
something
you
to get
go.
rid of all the fluids. Yep.
So sodium is huge. Keeping an eye on your daily weight and keep an eye on your fluid status.
Right.
Now, that is real important too. I want to show Craig. I want to show this here because I get a hard time every day. I weigh myself first thing in the morning, and this is a brochure that was printed. I'm not making this up. I want to put this up for my wife so I can show this to her. Look what it says here. Weigh yourself every morning after you go to the bathroom. Wear the same clothes, like the pants, the sweatpants I have on. Every morning I weigh myself at the same time.
Why is that important?
For heart failure folks, we're trying to catch the fluid before it gets to the breathing, before it gets to some of the more serious congestion issues.
So that's a good way of seeing that.
So we tell people if you've gained 3 pounds overnight or 5 pounds in a week, that is fluid. That's not, I didn't eat enough burritos to gain 5 pounds in a week. That's fluid.
But let's talk about women. I fluctuate like crazy.
But see, you just scared me here too, and you're right too. We talk about this all the time.
I'll fluctuate
5 pounds in a week.
like
That's
crazy.
normal.
Yeah, like crazy.
It's fluid if it's normal. So I would watch how much sodium you're consuming too and see if that plays a role in it. We have patients track their daily weight in their weight journal and then keep track of. You know, I've had some patients that come in and they will be fine and not have an exacerbation for a number of years, and then they eat Chinese or handballs or something and they have it more than one day in a row, and that sodium is enough to tip them.
Okay.
And they'll end up
So you're sensitive
with
to stuff like that.
Yeah.
You should be aware. Good to know.
And everybody's different. Everybody's not as sensitive to sodium or extra fluid. We also restrict how much people drink that have heart failure. Not everybody can be managed that way, but those are 2 easy lifestyle modifications. And then medications are critical. There are 2 medicines, ACE inhibitors and beta blockers, been around for years, but they do very important things in the heart to manage heart failure. And any cardiologist will tell their patients, even if you don't feel good on them at the beginning, they're the life-saving therapy that we have.
It's good to maintain and keep that heart healthy.
Yes.
Let's talk about that great news that we were hinting at the beginning.
Yeah, before as we wrap things up, because you guys did something last week, a couple of times, I understand, over at Lutheran, that the only other place that this has been done has been Mayo Clinic.
Yes.
And tell everybody what that was.
Exciting. Dr. Pallikerthy, our electrophysiologist with UnityPoint Cardiology, is putting in the CardioMEM unit. And it is put out by St. Jude's that makes defibrillators and other therapy for heart failure patients. And it sits in the pulmonary artery and measures the pressure. That will be a sensitive indicator long before it shows up in the weight or the breathing or any other symptoms for a patient. And so it sits in there. It's not doing anything in there. He implants it like he does when he does an angiogram up through the groin and puts it in the pulmonary artery. All the patient has to do, it's an outpatient procedure. They have a pillow that they lay on that communicates with that device, and so every morning they turn on their monitor, they lay on this pillow, and it measures their pulmonary artery pressure.
Wow.
It
Something you can now get in Des Moines, and you don't have to travel all the way to Mayo to
Lutheran's
receive.
the only place in Des Moines doing it. Dr. Palakurthy is the only cardiologist doing it.
Wow,
That is
incredible information.
More information, unitypoint.org to get all caught up. Again, it is a Heart Month, so keep that in mind.
Keep that in mind.
more.
Wendy, thank you so much. Pleasure to meet you this morning.
Thank you so much. It is 8:52. We'll be right back. You're watching Great Day live in Des Moines.
Can we go on?